Center currently performs both COVID-19 testing via the RT-PCR method and whole genome sequencing for the detection of variants of concern, such as the Delta variant. We currently perform 200 to 300 tests a day on average for RT-PCR testing and 750 samples a week for variant detection using next-generation sequencing. However, due to the recent identification of Delta variant in community samples, we have seen a marked increase in the daily COVID-19 test requests to as much as 500 tests a day.
Clinical laboratories nowadays have played an essential role in identifying cases, informing isolation decisions, and helping to curb the spread of disease. However, as the demand for COVID-19 testing has increased, laboratory professionals have faced a growing list of challenges, uncertainties, and in some situations, controversy, as they have attempted to balance the need for increasing test capacity with maintaining a high-quality laboratory operation. Our COVID-19 testing facility operates 12 hours a day, every day including holidays. However, due to the need for more testing during this trying time, our staff would almost always render more than 12 hours a day in order to meet the demands for testing. Our facility could test around 200 to 300 samples a day. Limitation to testing may be accounted for the machineries available as well as the number of staff. However, given these limitations, we try our best to deliver quality results within the reasonable turnaround time of less than 24 hours.
Our situation has been a unique one in the Philippine Genome Center, since we are a research institution first and foremost, and much of the early challenges we faced had been regulatory in nature, such as complying with the minimum standards for a clinical diagnostic laboratory and compliance to biosafety level 2 standards. But more than just this, the challenges have been constantly changing throughout the course of the pandemic. At the start, regulatory challenges, as I mentioned, were the primary issue, but moving into the latter half of 2020, issues shifted to shortages in essential reagents for testing. At present, the issues are now in result verification, as there has been a proliferation of counterfeit results bearing our institution's name.
Challenges not just in our facility but also to other facilities include access to testing for more people, especially of those asymptomatic population, in order to determine spreaders to the vulnerable population.
The donations will go a long way in sustaining the operations of our facility, especially given recent events that suggest the pandemic will continue for the foreseeable future. It is thus crucial for laboratories like ours that we have the support of institutions like USAID to help make free RT-PCR testing for eligible patients a sustainable endeavor. On behalf of the Philippine Genome Center, I would like to express my sincerest gratitude for your support and trust in our institution's thrust to provide accurate and timely COVID-19 diagnostic services to our fellow countrymen. In a time where working together is important more than ever in order to overcome this pandemic, it is reassuring that we have institutions like the USAID that share in our vision to provide critical services during this time of incredible need. Thank you once again for all of your support, and more power to you.
The USAID donation is a very big help to our LGU in order to increase our testing capacity, in order to see the true picture, to test the symptomatics, to be able to isolate them, and eventually prevent the spread of the COVID-19 virus within communities. So thank you very much for your generosity and for considering our LGU as a recipient of the testing kits. Thank you very much.